Hello, I'm Dr. Jing Yuan from the affiliated hospital of Zhongliang Medical University. In this video, I will briefly introduce our study on a novel localization strategy for targeted axillary dissection using carbon nanoparticle suspension. Targeted axillary dissection is an advanced surgical approach that helps reduce the extent of axillary surgery and its associated morbidity in breast cancer patients after neoadjuvant therapy. Instead of removing all axillary lymph nodes, targeted axillary dissection focuses on selective existing lymph nodes that were previously marked. However, conventional localization methods such as clip, wells, radioactive seeds, and dyes have their limitations, including poor long-term visibility, marker migration, radiation-related safety concern, and higher procedure costs. Our study explored the use of a carbon nanoparticle suspension, a 150 nanometer tracer composed of polymeric carbon granules. Due to its size and structure, CNS selectively enters the lymphatic system while avoiding entering into the blood vessels. In addition to functioning as a lymphatic tracer, CNS shows great potential for therapeutic applications. It has been demonstrated to absorb and release the chemotherapy drug in a pH-sensitive manner, allowing the more targeted delivery to tumors. CNS also exhibits photothermal conversion properties, indicating its potential for anti-tumor treatment beyond localization alone. From a surgical technique standpoint, injection sites is a key. Under real-time ultrasound guidance, CNS is injected into the soft tissue immediately surrounding the capsule of the targeted lymph node, not into the node itself. The needle tip serves as a precise reference point, and the injection must be carefully guided to avoid misplacement. The needle is advanced in plane with the ultrasound probe to maintain constant visualization. This approach avoids unintended staining of secondary lymph nodes, improves localization accuracy, minimizes repeated procedure, and enhances patient comfort. In summary, Peri-Lymph Node Tattooing with carbon nanoparticle suspension is a simple, safety, and cost-effective technique for targeted axillary dissection. It provides clear visual guidance during surgery, avoids the drawbacks of conventional markers, and holds the promise for broader clinical application. That concludes the main findings of our study. Thank you for watching.